Okay, test number 3, prep. Okay, we're going to talk about chapter 5 and chapter 6, and again, I'm going to try to pinpoint specifically some of the information that's in the test. So we're going to start talking about community public health practice, and in this chapter, we're introduced to this idea of doing health assessments within the community. Um, Governmental presence in health. Make sure that you understand that concept. And it basically means that a lot of these functions are supposed to, public health functions are supposed to be initiated at the governmental level. So the government is supposed to have a presence within the health community. So make sure that you understand that concept extremely well. Um, I think, again, I'm going to kind of skip through a lot of this. We're going to take a look at the Institute of Medicine, the IOM, and their core functions of public health practices. The Institute of Medicine is a division of the National Academy of Sciences, which is probably the most prestigious scientific group in the country, and then that makes the IOM then is also extremely well regarded. So again, the government presence in health, governmental public health agency has a vital function, and this is the idea behind the IOM, at least their assessment of public health. Um, and they talk about, of course, needs assessment, and we talked about this already quite a bit. What should be done? Why do we need to do things? What are people getting sick from, and how can we prevent that? Hopefully, how can we develop policies to address the morbidity and mortality issues that we're facing within our culture? And then how can we assure that these programs are actually going to work? What evidence do we have that says that these programs are actually going to be effective? Um, Take a look at this. This is some of the public health. So, kind of important uh, here. It says under essential public health services, and if you scroll down here, it says enforce laws and regulations. That is one thing really that public health people do not do, even though it says it in here, is enforcing laws and regulations. That's something that, generally speaking, is not part of the core initial concepts within public health, even though that particular slide had it. Again, accreditation and extreme, let me go back to this one really quick. Sorry. Public Health Accreditation Board. I would recommend if you want to work in public health that you get some sort of accreditation. There's a couple different ones that you can work for. But then, it's just, why should you get accredited? It looks good on a resume. But you're measuring your performance against, a nationally recognized set of standards. It's nationally recognized, of course, and it'll look good on a resume, of course. So consider doing it, especially if you want to work in public health. Let me kind of skip over this. The community health assessments and the health improvement plans, we're going to talk about those for a couple minutes, and specifically how the local health departments and the hospitals are collaborating together. So at this point, you can say that most of the hospitals and local health departments are collaborating. At least 53% are collaborating, and then another 15% are at least working on trying to develop a collaboration, which is good news. And the idea here is that if the health department gets involved, hopefully they can prevent some of these people ending up in the hospital. That's obviously our goal within public health. And if you take a look at, I'm going to skip through some of these. We're not going to do a SWOT analysis or the SWOC analysis, so we're going to kind of skip over this. We're doing our own thing with using the CDC information, so we can kind of skip over that. This is a very important slide. The state health agency and the local health department participation in health assessments, health improvement planning, and strategic planning activities. And again, I forget exactly what the questions on the test are, but it's something along the lines of what percentage of state health agencies performed state health improvement plans. I think something like that. And in this case, it would be 43%. So just make sure that you're reading the correct, is it the state or the local health agency that they're looking at, and what type of plan or assessment are they asking for, and make sure you match up the right numbers. And then we can skip over to chapter number 6 now. Okay, chapter 6, public health emergency, preparedness and response. So public health emergencies, more and more are happening every day, unfortunately. So we're going to talk about, I'm going to post some information about Hurricane Katrina and some of the issues that surrounded that particular public health crisis. But we could be talking about influenza outbreaks. Pandemic influenza is a realistic threat at this point. It's considered one of the major threats to public health by the World Health Organization. But massive flooding, bioterrorism, all these things are major concerns. And the public health community needs to be prepared in how to respond to this. And if as you're developing your public health plans in your local community, think about what potential public health disasters or emergencies could occur within your specific community. And we need to make sure that we are prepared for that. So, for example, do you live in San Francisco, which might be prone to earthquakes? Some of the public health roles as far as emergency response and preparedness, the big one is laboratory investigation and analysis. And that's usually one of the main things that we see, especially during some type of an outbreak, is that all the local and state laboratories will get involved, and the network of all those laboratories are very heavily involved. And of course, even though epidemiologists only account for about 2% of the total public health uh, occupational staffing, there are, of course, they will pull in the epidemiologists, then do some sort of intervention, hopefully communicate the risk out to the population. That's a big response, and then community-wide response, of course. There's a whole unique thing to bioterrorism. I actually have a good friend that just retired from the military, the United States military, who specializes in bioterrorism. He's going into private industry now. It's a whole huge field, so you might want to consider working in that area as well. Pay very well, apparently, as well. So I don't go into bioterrorism specifically here, but you know, certainly consider this. You can consider doing like a bioterrorism uh, preparation plan for your local community. That might be a good idea, especially if you live down in the southern communities. You're considered. It's not really bioterrorism, but like the Zika virus, it's not really a major concern at this point in the United States, but it could be at some point. Um, there's all these major national incident management systems and the national response plan. We see the Department of Homeland Security. FEMA is not on here for some reason, but they probably should be. FEMA is I'm horrible with acronyms. I forget what FEMA stands for, but they're the ones that respond usually when you have a major thing. So I'm not going to read through this. A major disaster, FEMA is usually the ones that respond. The problem is that there's been some arguments about whether a lot of these um, disasters are supposed to be dealt with at the state level or the federal level, and unfortunately, there's been some miscommunication as a result. So, public health activity expenditures. I don't think this specific question in here, but you can see again, most of it is happening at the state level, the state and local level. Um, I think a lot of this I can kind of skip over. National standards for the public health practice capabilities. Again, biosurveillance, especially the laboratory testing, extremely important. And then the rest of it is community preparedness and recovery, which is obviously extremely important. Countermeasures and mitigation, incident management, that's where FEMA would come in, information management, and then surge management, which is like fatality management, mass care, volunteer management. You don't even consider that, but a lot of times when you have a major disaster, one of the first things that happens is you get this whole slew of volunteers that want to come in and help. And obviously they can be helpful, especially if they're medical personnel. Um, I think this is a question on the test, so you might want to take a look at this a little bit closer. Not 100% on that, but I think there's a question, not on that one, but on that first one. And I think a lot of these, um, I can't remember if there's a question about this one. Sorry, everybody. I'm kind of skipping over this a little bit quick. Yeah, I don't think there's specific questions on this one. Um, this is a good activity. If we were in class, I might consider doing this, but we're doing so many other public health stuff and public health planning. Again, if you want to work on some type of an emergency response preparation, I've had students do that in the past, and they used a lot of this chapter to help them develop their programming. Um, and I think that's pretty much it. Okay, so hopefully this was helpful for test number 3.